According to the results of this study right here that you can see up on your screen, researchers, for the first time, have found a treatment that completely removed the rectal cancer in every patient that participated in the trial, meaning that every single patient in the study is in remission with no chemo, no radiation, and no surgery. And even though the study was small, the results, they're not only heartening, but also, according to the lead researcher in the study, they open up a potential new corridor at fighting cancer, which they will be quickly expanding to things like stomach, pancreatic, as well as bladder cancer. Furthermore, the therapy that they're testing, which is monoclonal antibodies, they have none of the toxic side effects of other popular cancer treatments, especially the ones that are currently being used at scale. And so with all these positive elements lining up here one after the other, let's go through the details of the study together. To start with, this paper, it was published in the New England Journal of Medicine, and it's titled PD-1 Blockade and Mismatch Repair, Deficient, Locally Advanced Rectal Cancer. This study was led by researchers over at the Memorial Sloan Kettering Center here in New York, and they were testing the viability of monoclonal antibodies as a treatment for people suffering from advanced forms of rectal cancer. Specifically, in this study group, the researchers had 12 patients, with the median age being 54 and with 62% of them being women. And these patients were all suffering from advanced rectal cancer, specifically mismatch repair deficient stage 2 or stage 3 rectal adenocarcinomas, which is a type of cancer. And normally people with this type of cancer would undergo debilitating treatments such as chemotherapy, radiation, surgery, or even in extreme cases, they would have to be fitted with colostomy bags. However, the patients in this particular study did not undergo any of those treatments, and instead, they were given a certain type of monoclonal antibody every 3 weeks for a period of 6 months. And according to the results section of the study, all the patients, every single one of them, experienced a complete clinical response. They went into remission, and they went from having advanced cancer to instead having no trace of tumors. Here's specifically what the study found. Quote, a total of 12 patients have completed treatment with dostarlimab, which is the monoclonal antibody, and have undergone at least 6 months of follow-up. All 12 patients, 100% with a 95% confidence interval, had a clinical complete response with no evidence of tumor on magnetic resonance imaging. At the time of this report, no patients had received chemoradiotherapy or undergone surgery, and no cases of progression or recurrence had been reported during follow-up, ranging from 6 months to 25 months after treatment. No adverse events of grade 3 or higher have been reported, meaning that as a result of the administered monoclonal antibodies, the doctors were not able to see any evidence of any tumors among 100% of the trial participants, which, according to Dr. Andrea Sursik, who was one of the lead researchers in this particular trial, is something that they have never seen before. Here's specifically what she said during an interview over on CNN. Quote, it's absolutely incredible. We didn't expect it. We've certainly never seen this before. It's really what, cancer doctors' dreams are made of, to see a response like this, such incredible efficacy with really almost no toxicity. The patients are feeling great after the treatment with completely normal body function in something like rectal cancer, where normally our therapies are really quite toxic. So it's absolutely incredible. Then, in terms of how these monoclonal antibodies actually work within the patient's own body, she explained that essentially, they unlock the body's ability to heal itself. Here's what she said on that front. Quote, so it's an immunotherapy, and it works by unlocking the body's natural immune system to fight cancer. And this type of therapy works in specific cancer cells in colorectal that are mismatch repair deficient. So they lack a gene that enables them to repair their DNA. And because of that, they have many, many mutations. And the immune system recognizes the cancer as foreign. And so when we give immunotherapy like dostarlimab, it really just revs up the immune system so that it sees the cancer and gets rid of it. But what's so remarkable here is that it completely eliminated the cancer. The tumors just vanished in all 14 consecutive patients. Normally, when this is used in colorectal cancer in patients with advanced disease, that happens in about 10% of patients. And here, it's 100%. So that's really the most striking part of this, is that it happened in every single patient after just 6 months of therapy. Now, the way that she described the mechanism by which these monoclonal antibodies work is accurate, which you likely know if you happen to live in any state that widely used them to treat COVID during the years of the pandemic, like, for instance, the state of Florida. These monoclonal antibodies, they are similar to the antibodies that our own bodies naturally produce in response to an infection. However, the only difference is that these monoclonal antibodies are mass-produced in a laboratory. But the purpose is ultimately the same. They're meant to give the person's own immune system a giant boost in mounting a response. Furthermore, the much more exciting part of this particular study is the fact that even though this trial was limited to rectal cancer, the researchers are planning to, as soon as possible, begin testing the same methodology on many other types of cancers as well. Here's in fact what Dr. Sursik said on this particular front. Quote, "The idea here is that we move this therapy from advanced disease into early stage disease. And clearly, we're seeing that there is increased sensitivity when the tumors are early stage, when they are in the organ where they began. And so our goal is to replicate this in other solid tumors such as stomach cancer, pancreas cancer, and bladder cancer that are mismatch repair deficient where they have this potential sensitivity to immunotherapy. And that can have huge implications, just as it did in these 14 patients where they didn't need radiation and they didn't need surgery. But we may be able to achieve that as well in patients with stomach cancer where surgery may not be needed if they have the same type of, really remarkable response." Now, there are a few limitations here, such as the fact that these researchers, at least at the present moment, are only looking at cancers that are caused by mismatch repair deficiency, which is when our cells experience mutations in their genes that are responsible for correcting mistakes that are made during the DNA copying process. And so a mismatch repair deficient cell, it usually has a lot of DNA mutations, which may lead to cancer. And this is the type that these researchers are studying, at least initially. Furthermore, there is the issue of price, because the specific monoclonal antibody that they're studying, dostarlimab, is currently sold under the brand name Jemperli. And according to drugs.com, the cost of 10 milliliters of Jemperli is around $11,000. Now, the study, it said that patients received dostarlimab treatment every 3 weeks for a period of 6 months, which, if you do the math, would amount to 9 treatments in total across 6 months. However, the study did not mention the actual milliliter amount used during each dose of treatment. However, we can imagine that the cost of this treatment is likely in the tens of thousands of dollars, which would actually still make it a lot less expensive than some of the other treatment options that are typically recommended, such as surgery, chemotherapy, as well as radiation, and it would also have a lot less toxic side effects. And so the net here is all positive. But of course, this was just an initial study, and Dr. Sursik mentioned that they will be conducting many more studies of this particular treatment in the very near future, and so you can stay tuned for that. Until then, if you'd like to read more about this particular study, I'll throw the link to the research that was published in the New England Journal of Medicine. You can find it down in the description box below if you're the type of person that likes to dig into the weeds. All right, just to pause here for a super quick moment. Listen, it's obvious that the financial system is not looking too great. After being pumped up with trillions of virtually free government dollars for many, many years now, well, the stock bubble might actually burst in the near future. And in that process, unfortunately, it could take away the nest egg of anyone who happens to be exposed to it. And so consider taking this opportunity to diversify into something which is beyond the grasp of Washington, D.C. and Wall Street, physical gold and silver. And the best company to use, in my opinion, is the sponsor of today's episode, American Hartford Gold, who I should mention is also my own personal gold and silver bullion dealer. And besides myself, they have thousands of 5-star reviews from other Americans, and they also have an A+ rating with the Better Business Bureau. And working with them is rather simple. They have a huge selection of coins, bars, and rounds to choose from. They have super friendly staff who you can call, and they can set up either gold delivery directly to your doorstep, or they can even set you up in a gold IRA. And then lastly, best of all, if you tell them the Roman sent you, they will throw in a free gold coin with your first qualifying purchase. So give them a call. The number is 866-242-2352. That's 866-242-2352. Or you can simply text Roman to 65532. I'll also throw a link to their webpage. It'll be down there in the description box below. And then until next time, I'm your host, Roman from the Epoch Times. Stay informed. Most importantly, stay free.